Morning, welcome back to 2 News Today on Dayton CW. I'm Dan Edwards. Our time now 8:17. Jamie's forecast and Carrie's traffic update just ahead. But now I'm joined by psychologist Mary Beth DeWitt from Dayton Children's to talk about autism. Doctor, thanks for joining us this morning.
Sure,
you know, April is Autism Awareness Month, and I was reading that U.S. officials suggest that nearly one in every 50 children has some form of autism. I guess we should start with what exactly is autism?
Sure. Autism is a developmental disability characterized by three main areas of concern. The first is deficits in communication skills. Secondly, deficits in social skills and social interaction. And thirdly, a restricted and repetitive pattern of interests. Generally, the condition comes to our attention before a child's aged 3, but some of the higher functioning forms of the disorder we can pick up later in life when they're maybe 7 or 8 or 9. It is a lifelong disability, so children are affected into adulthood and continue to have deficits in those areas.
1 in 50. I mean, it strikes a lot of families watching currently probably have maybe an issue in your family. I know certainly in our family we have a child that's been diagnosed. How difficult is it to diagnose, and does it go undiagnosed a lot?
Sure. Autism is a behavioral diagnosis, so we really have to look for symptoms and signs. There's not a clear test for autism. It's not blood work that you can do. It's based primarily on what symptoms that we see. So in a young child, sometimes it's difficult. They might be afraid of us or concerned in that environment. They may not give us their true interaction pattern. So it can be difficult, but we've learned good skills to interact with kids and get down to their level and play with them. Most of our assessment is based on observation and interaction. And we're able to identify it early.
What are we looking for with children? I mean, it starts at an early age. You can start seeing some of these signs, correct?
Right. Really, it comes to our attention primarily because children may not be using language or may have lost some of their language skills. So in a child that is 12 months to 14 months that's not babbling or not making any kinds of speech sounds, we're concerned about that. If they're not using words by 16 months, we're concerned about that. We look for maybe lack of eye contact or lack of interaction with their parents, lack of interest in interacting with their parents. They may not pretend or show things to other people. Those are the signs that we look for early on.
Can they be expressionless at times? That really not showing that emotion that they should at that age?
Absolutely, and sometimes children prefer to be on their own. They're kind of content in their own little world doing their own things and may get upset if people try to intervene and interact with them. All
right, doctor, if someone watching right now is beginning to see a red flag rise, what should we tell them to do?
Clearly, they should talk to their pediatrician about any concerns that they have. Their pediatrician, who's an expert in development, can determine if they need additional assessment through a specialist at Dayton Children's or another local hospital, looking at their development, their speech and language, and determining if they need intervention.
Can an autistic child go on to have a relatively normal life?
It is a lifelong disability, so we expect that those core features will be present throughout their life, but certainly our goal is to intervene early and make the child as happy, healthy, and productive as possible over their lifetime. Absolutely, they will make progress and learn. We just have to find ways to teach them best, which tends to be more of a directed approach. One-to-one teaching works best with these kids to really get in there and teach them the skills that they need.
So it's difficult for the educational system to handle these children
Absolutely.
properly.
Absolutely.
In your opinion?
Absolutely. Many children with autism don't learn as typical children do by watching others and interacting with others. So we really need to take more of a directed approach with them and teach them skills directly. This is difficult in schools where they may have 8 to 10 or even more children in class per teacher.
Dr. Mary Beth DeWitt from Dayton Children's, thank you so much for sharing your expertise and your time with us this morning. We appreciate the information.
Thanks very much.
Hope it's helpful for you as we're working for you to make your life better. Our time now 8:21, and just ahead on 2 News.